Hi, hello, namaste. Welcome back to our channel. Nenu mi Vaishu. Cancer. It affects everyone, the young and the old, the rich and the poor, men, women and also children. Cancer affects everyone. And we also know it is the most effective cause of the deaths in the world. And we also know it causes tremendous pain and burden to the patients. So today we have Dr. Srinivas Chakravarthy Gummaraju garu, oncologist and hematologist, senior consultant, Apollo Hospitals, executive directors in oncology and hematology departments. We have sir today. We are going to discuss about childhood cancer. Come on, let's go. Let's clear out all your doubts. Hello sir.
Hello.
Namaste sir.
Namaste.
From India.
Namaste.
Hi sir from America.
Oh, thank you.
My first question is, how common it is to get a cancer for a kid?
In childhood?
In childhood.
Childhood cancers are actually rare compared to adult cancers.
Okay.
In India, the incidence is something like about 4 cancers per 10 lakh population.
Okay.
But the interesting thing in India is that there's a wide variation between different regions of India. For example, Delhi, Chennai, Mizoram, they report a very high incidence of childhood cancer. The other parts of the country do not report that high cancer.
Okay.
So, and the incidence is also different from the West. Some of the Western countries have a much higher incidence of childhood cancer. India doesn't have that high an incidence. But incidence, you mean, like I said, per 10 lakhs, how many cases you have? If you count per 10 lakhs, it's not as high as some of the Western countries. But because we have a population of 140 crores, that amounts to a lot of children with cancer in this country.
Okay. Cancer is big, as you said.
Cancer is big.
Yes. Okay, sir. Can we prevent or how can we protect our children from cancer? As they say, prevention is better than cure.
True,
can we prevent it?
Very true. Prevention is far better than cure, and the question is absolutely right. Unfortunately, we don't know the answer yet. Why do children get cancer? The reasons may be different from why adults get cancer.
Okay.
One common reason why children get cancer is certain inherited genetic deficiencies. For example, you might have heard of Down syndrome.
Yes.
So Down syndrome can happen as a deficiency in the chromosome. Some children are born with Down syndrome.
Oh.
People who are born with Down syndrome have a high risk of getting cancers over their lifetime, including in childhood.
Okay.
Some children get a genetic defect in a gene called RB1. They get an eye cancer called retinoblastoma, which can actually start even when the child is in the mother's womb,
Okay.
even before birth.
Oh.
So there are certain genetic deficiencies in which the children is at a very high risk of getting cancer. That is one cause
Okay.
that we cannot prevent. Because if you're born with it, you're born with it. Many children, we don't know the reason.
Okay.
Probably exposures to certain kinds of pesticides, probably pollutants in the atmosphere. For example, childhood cancer is actually reported very highly from Delhi. One of the region around Delhi, the NCR region.
Yes.
One of the reasons could be that extremely high rates of pollution around Delhi, as we keep hearing, for a variety of reasons. So those could be the reasons.
Okay.
So these are the most common reasons. So how do we prevent? We don't know really how to prevent. Prevent means not let the cancer come at all. So in adults, we know how to prevent, at least in some cases.
Okay.
But in children, we don't really know how to prevent. But what we can do is, families can be aware of what kind of cancers happen in their families. If any family relatives have cancers, they can talk to the doctors to see if there is any possible genetic basis for getting a cancer.
Okay.
And if there is suspicion, then get tested for the genetic basis even before they have a child.
Oh.
The other thing is to be very aware that childhood cancer is a very real thing, and to be aware of any abnormalities in the child. For example, one very common childhood cancer in this country is retinoblastoma, which is a cancer of the eye. So the children sometimes can be born with it and you won't know it.
Okay.
The child will behave normally for a long time. But if you see that they are not moving one eye, or if they have a white layer in the one eye, or one eye is bulging in comparison to the other eye, you can look out for things like that. Another thing that can happen with children is very frequent infections. All children get infections. Infections are common. You and I will get infections. Children will get infections.
Of course.
Children get infections more commonly than adults do. That's normal for them.
Okay.
But people who have an infection that will not go away, that have a fever that lasts for more than 3 weeks, let us say, or if they are losing weight, or they are very fussy, they have been eating well, but they're not eating well anymore. If it's an infant, they're not suckling from the mother's breast strongly. They have suddenly become very lethargic and are not as playful as they were before.
Okay.
All these things are things that you should be suspicious about in a child.
These are so sad actually. And this is my personal question, sir. As you have Subha Comprehensive Cancer Private Limited Hospitals, as you are chairman of that,
Yeah, sure.
how rare you see childhood, ante children in the hospital about being a cancer patient
I think of all the patients we get, approximately about 5% will be childhood
in
cancers.
childhood. Yeah, okay. What might be the problems, sir? Like, what are the problems they come with?
So the question you're asking, what is the commonest problem that they come to you
Yeah.
with? That depends on what cancer they have. So both questions are related.
Both questions.
What is the commonest cancer and what are the symptoms? Cancers are different. No? Each cancer is very different. So a child with a different kinds of cancers can have different symptoms.
Okay.
That's what they come with. For example, like I just said, retinoblastoma is an eye cancer that is very common. We just discussed what they can come with. That child is not seeing properly.
That is very
or they have
common.
white. It's just quite common in India. Leukemias are very common. So acute lymphoblastic leukemia, or otherwise called ALL, is a very, very common cancer in this country, especially among children.
In this country.
In
And
this
in states, sir?
The West also. The West also.
Okay.
ALL is extraordinarily common in this country. ALL, like I said, children can get frequent infections. They come with fevers that will not go away. They're not suckling properly. They're losing weight, or they're getting small spots, small bleeding under the skin, or in the stool, or in the mouth,
Okay.
things like that. Then some children have a kind of brain cancer
Oh,
called medulloblastoma.
children.
Yeah, children can have a kind of brain cancer called medulloblastoma.
Okay.
So in that, they will have frequent headaches, they'll keep crying, and they can't see properly, they degenerate, and there's not enough neurological development, so on and so forth.
Okay.
Some children can have a cancer in the kidney called a Wilms tumor.
Okay.
That is also fairly common. And the children with Wilms tumor, their abdomen can swell up, they may have discolored urine, or they may bleed in the urine, things like that.
Okay. If your children are behaving like this in the home, just don't take it easily, okay? Just go to sir especially. Sir is the specialist in that. What is the reason and causes for the children to get the cancer?
We just mentioned that we don't know. Vast majority, we don't know the cause.
The vast.
It's probably just an accident that happens. Remember, we are all made as one single cell. We all start life as one single cell. When the mother's egg meets the father's sperm and they become one, they fuse and they become one. That one cell is how we start life.
Okay.
And that one cell has to divide, become 2, 4, 8, and so on and so forth. That's how we grow so big. As these cells are dividing, even in childhood, sometimes small errors can happen when they're dividing, especially in the chromosome of the genes.
Okay.
So the vast majority of childhood cancers are probably caused by random errors that happen in these rapidly developing cells, because children are growing very rapidly.
Yes.
Their cells are dividing quite often. Random errors can creep in, and one of those cells can become a cancer cell. Like that. So
Okay.
that is probably the most common reason, just random errors. And as I just mentioned, some people do inherit a genetic defect that can cause childhood cancer.
Okay.
For some children, probably environmental pollution like pesticides, certain organic solvents, carbon tetrachloride, things like that. So certain chemicals may actually increase the risk of having cancer.
Okay. What is the survival rate? Like, cancer patients also can survive.
Yes, of course.
That is the truth people has to know.
True.
So
I think you're absolutely right. The first thing that you mentioned, and I want to stress again, is cancers are curable these days. Not all, but many cancers are curable. Especially childhood cancers, the majority are actually curable. This is very important to realize.
yes.
God forbid nobody should get cancer. As you said, cancer is big. By the grace of God, no one ever should get cancer.
Yes.
But if you do have to get cancer, actually children are more curable than adults are.
Okay.
So the cure rates of children are generally much, much higher. But there's one point I'd like to say here. If properly treated,
Okay.
we have access to good medical care. Children in the West in general have cure rates between 70% to 90%.
Oh.
That's not a small
That is
number.
high.
That's huge. It's not a
Yes,
high number,
that
it's a
is
huge
huge.
number.
Yes, that is
That
huge.
means the vast majority are cured.
Okay.
Unfortunately, in India, if you take all children with all cancers, general cure rates are only between 20 to 40%. Same cancers,
Oh my
same
God.
treatment.
Why is that?
So the three main reasons for this.
Okay.
One reason is lack of awareness,
Okay.
because parents are not aware. Vast numbers of India are either rural or middle class who are not aware of these situations. They ignore most of
Yes.
these things. So the child is typically brought late. More important than that, second is lack of access.
Okay.
Now the best cure rates come from doctors and from centers which are highly experienced in treating pediatric cancers. That means whatever doctor you're going to and whatever center you're going to, The better experience they have in treating childhood cancers, the better the outcomes will be. So we do not have access to things like that. So Hyderabad, you will hear of many cancer centers here.
Yes.
But once you leave Hyderabad and go 100 miles out, there's nothing.
Okay.
So for an average farmer, either he is ill or his child is ill, to travel 100, 200, 300 miles and come to Hyderabad for treatment for everything is a very, very difficult thing.
Okay.
So access is a huge problem. Third is money. All this takes money.
Yes.
Although I want to mention here that the costs of treatment, cancer treatment in this country are less than 1/10 what it costs in the West.
Okay.
So I have treated people, I've practiced for a long time in the USA and here also. Same cancer, same drugs, same quality of care is much, it's 10 times more expensive in the USA than it is here.
People even think that cost is very much,
True.
so we can add up.
True. So it's a lot cheaper in India. Same quality of care you can get for a lot cheaper in India than you can in the USA. But for the average Indian, that's still expensive.
Yes.
100 rupees may be very cheap compared to the US economy, but 100 rupees for a typical poor person here
yes,
is a big amount. Cost is a big issue. Finally, infection rates because of poor hygiene.
Okay.
We have very poor hygiene here. Poor hygiene leads to bad diet, so malnutrition. Because our diet patterns, either we follow a fad or we follow local diet patterns which may or may not have enough nutrients in them. So malnutrition and infection rates are higher in this country than in the West.
Okay.
So these are the 3 or 4 factors that add up to decrease the cure rate.
Okay.
And frequently we see in our practice, children come, even when they come on time, they are brought, the parents are very aware and they're very committed to the child. We start treatment and things are going very well.
Okay.
Typically halfway through the treatment they disappear. They don't come back again.
Why is that?
The typical attitude is cancer is gone now. Child is fine.
Okay, they think of that.
Why do I need to continue more? Because there's a pressure on time. There's a pressure on the journey because they have to travel.
Yes.
There's a pressure on money.
Okay.
So I think it's important for parents to have an ongoing dialogue with their doctor. The doctor is not their enemy, it's their friend.
Yes.
If there are any problems of this kind, I think they have to discuss with their doctor very clearly and make sure what are the facts, what is reality.
Yes.
Before they take decisions on stopping treatment or continuing treatment.
Okay, as you are talking, people think that if they get cancer, they are going to die. That's all. This is the end for their life.
True.
People can get cured of cancer.
Yes,
they are not going to die.
You're right. I think we should stress that again.
Yes.
Majority of children with cancer can be cured.
Yes.
There is no, if in the West 90% of children with, say for example, ALL can be cured, there is no reason why more than 90% of children in this country can't be cured. So the majority of children can be cured of childhood cancers.
Can be cured.
Can be cured.
Yes.
Majority. And whatever hurdles we have for that are all social hurdles.
Yes.
They are not really medical hurdles. So these social hurdles, we should all be committed to crossing those social hurdles.
Okay. What are the symptoms of childhood cancer, sir? Like, how can we know my child is having cancer, so I have to go to the doctor?
So as I said, if the child is not eating properly,
okay,
child is losing weight, significant amount of weight.
Sudden losing weight.
Yeah, suddenly losing weight.
Okay.
Or he has a fever that will not go away in more than 21 days.
Okay.
Most viral infections are very common in children.
Yes.
Most viral infections go away inside of 2 to 3 weeks. So any fever that does not go away more than 3 weeks,
okay,
that's a cause for concern.
Okay.
Children who do not suckle their mother's breast properly.
Okay.
They're lethargic. They don't want to play anymore. They're constantly crying or irritable. These are the common symptoms that you should watch out for.
Okay. How do you rule out cancer in children?
Any good doctor can do that. Even your local well-trained pediatrician would be able to do that. So what they do is first they talk to the parents about what exactly the symptoms that the child is having, that is what is the child complaining of. Then they do a physical examination. Physical examination is very important. We get a lot of clues when we actually examine the child ourselves.
Okay.
Finally, certain kind of scans, certain kind of tests can tell us.
Can tell you. Okay.
The most important way to make a diagnosis of a cancer is after the scans, if there is any suspicious lump or anything like that, we have to do a biopsy.
Okay. What is the deadliest childhood cancer, sir?
The deadliest?
Yes.
They're all potentially deadly if you don't treat them properly.
Okay.
There are certain kinds of cancer like neuroblastoma, medulloblastoma. They can be very, very deadly because it may be late by the time we recognize them. The incidence of resistance is much higher in this country for certain kinds of such cancers.
Okay.
Resistance means whatever is a standard treatment that we use to treat them,
Okay.
they may not succumb to the standard treatment. So there are some cancers which actually can be deadly. But again, I repeat, and I'll repeat again, the vast majority are actually curable.
Okay. It is curable. You should know, like parents has to know that.
True.
Yeah, okay. Sir, childhood cancer survival rate, you have to say in percentage, if you have to say in percentage, how much it is? Like
Compared to
survival
adults?
rate? Yeah.
Overall, each cancer is different.
Okay.
So every cancer is very different. Every
Okay.
cancer's treatment is different. Every individual is different. How a given individual respond to cancer is different. And what stage they come in, or what are the strengths and weaknesses of the cancer cells, these are all different. So the survival rates differ almost from person to person.
Okay.
But having said that, if you take all cancers, overall curability, let me make it even simple. The survival rate or curability. That means if
Okay.
you survive for 10 to 20 years, that's as good as cure rate. Curability overall, approximately 40 to 60% of cancers are curable in adults now. As of
In
today.
adults?
In adults.
Okay.
In children, that is between 70 to 90%.
Oh, that is great.
That is great, yes.
Okay. Children cannot be feared of cancer, having cancer. Okay, thank you, sir. For that.
Usually it's the parents who are more afraid of the cancer than the child.
Yes, exactly. Yes. There is a myth like children can be cured of cancer, but even though in their adolescence, they get that cancer again. Is that the truth?
It happens. It's not the truth for the majority actually.
Okay.
Like we just said, see, when we say that 80-90% are cured,
Yeah.
cure means you won't get it back again.
Okay.
But again, when I say 90% of ALL cases are cured, that automatically means 10% will come back.
Okay.
So yeah, so they'll be say for example ALL. If you treat it properly, 90% of children with ALL can be cured. And cure means it will go away, never come
Never
back.
come back.
And they'll grow up into healthy adults and God willing will die of old age.
Okay.
But that means 10% it will come back, and it typically comes back, let us say for example in 2 years to 2 to 5 years is when it typically comes back in.
Okay.
So by that time that they're usually in their adolescence, as you point out, but that's a minority.
Okay. Sir, what is the difference in India and in states of childhood cancer? Like, what are the people has to take, it is serious, we have to take care about that. What is the difference?
Difference, I'll say number one difference is in the overall incidence.
Okay.
Overall incidence still in the West, if you count per 10 lakh population, the incidence of childhood cancers are a little higher in the West than they're here. Something like 6 to 7 cases per 10 lakh populations. In India, as far as reporting is concerned, it's still about 2 to 4 cases per 10 lakh populations.
Okay.
So incidence is slightly less in India than it is in the US, except that the number of cases are much huger here.
Okay.
Because our denominator is very huge. The second difference I would say is in the kind of cancers.
Okay.
In this country, we report a lot of retinoblastomas, which is a kind of eye cancer.
Eye cancer.
We report a lot of ALL, which is a kind of blood cancer.
Okay.
And we do report high numbers of Ewing sarcoma, which is kind of a bone cancer. But in the West, they report a higher incidence of CNS tumor, the medulloblastomas,
Okay.
neuroblastomas, Wilms tumor. These are reported higher in the West. So there's a difference in incidence, and we don't know why. It may be because of differing environmental risk factors.
Environmental. Okay. That's all my questions, sir. Do you have any, like, you have something to say to our audience, like childhood parents?
I have a lot to say, but because time is short, I'm going to say one thing. The most important thing is be aware.
Be aware.
There are a lot of dangers in life for everyone, children or adult. Cancer is one of the biggest dangers. Be aware that it can happen in small children as well, and be aware of these unusual symptoms and signs as we just discussed. Second thing is, realize that the cure rates of children are much higher. Do not be afraid of going to the doctor. Do not be afraid of seeking proper treatment.
Yeah.
Third is, for a lot of parents in this country, cost is a major issue.
Yes.
If cost is an issue, remember we do have government schemes. We have Arogyashri in this state. We have the National Health Scheme in some of the other states and in the central institutes. Also, those of you who are not eligible for such things, remember that your treating team are your friends. They are not your enemies. So talk to your doctor, talk to your social worker, talk to your nurse. They can help you. They can get you discounts from the institutions. They do have things like crowdfunding. They have things like microfinancing.
Yes.
So there are ways in which we can help financially. Finances are issues.
Okay.
Third is, don't be too sentimental. we suffer from a lot of sentimentality in this country.
Yes.
Sentimentality is good, and it has its benefits, but we take care of our children better than many other cultures do.
Yes.
But at the same time, sentimentality blinds your eyes to reality.
Yes.
So when we see a child, for example, losing hair during treatment, or maybe getting ulcers or feeling weak because of the treatment, we become very sentimental, we become upset and say, because we cannot see our child suffer. That is the truth.
Yes.
I cannot see my child suffer, you cannot see your child suffer.
Yes, of course.
But remember, they're stronger than adults.
They are stronger.
Children are stronger than adults. They come out of it better than you and I can. God forbid that we should ever be in that situation. But they can actually come out of it way better than you and I can.
Even the survival rate is very high.
Even the survival rates are very high. So trust in the fact that children are more resilient. That's how God made them. God made kids to survive.
Yes.
Trust in their strength, trust in their resilience, trust in the treatment, be part of the treatment team, be in the confidence of your doctor, and complete treatment. Because if you stop halfway through, it's like throwing good money after bad money.
Yeah.
Why did you even start it then?
Don't even hide.
Yeah, don't hide. And why come halfway and stop? If you're not going to do it, you're not going to do it. If you're going to do it, then complete it.
Complete it.
Finally, and most importantly, you have to take care of yourselves.
You have to take care of yourselves. That is the line I like most.
This is, I have seen this in a lot of mothers especially. Mothers are so concerned for their children. Night and day they will spend with the sick child.
Yes.
What happens is they lose their health. They become unhealthy. Then there is nobody to take care of the child. The father is busy getting money and arranging the social factors. Mother is there by the child's side. If you don't sleep, if you don't eat, and everything you are devoting to a child, who's going to take care of you then?
Okay.
So it is very important to take care of yourself. Because if you have strength, then your child gets strength.
Yes.
Very important to treat your child as normally as possible. That is another cultural thing that we have. That in this country we say, and our cultures like us,
Yes.
we say, oh, you don't get out, no, stay in the bed, don't trouble yourself, don't go to school and all that. If you do that, we may cure the cancer, but in the long run, the child is going to have psychological problems.
Yes. Children having that,
Correct.
children will always have that in mind. Yeah, okay, I am that sick person.
True.
I'll stay in bed. I
True.
have to be here.
True. And they grow older and they're completely cured, but they have things like depression, post-traumatic stress disorder, so on and so forth. So to avoid that, it is important to treat a child as normally as possible. Encourage him to play, encourage him to go to school.
Do normal things.
Do normal things as far as possible, within the bounds of safety. Your doctor can tell you what is safe and what is not safe.
Yeah.
So whatever is safe, you can encourage him to be as normal as possible.
Trust your doctor.
Trust your doctor, trust your child. I had a child actually who was getting treated for acute leukemia, and he had very bad time, he had a very rough time.
Okay.
He actually continued studying for his class exams throughout the treatment.
Oh.
That was his escape. Sitting with the textbooks and reading them was his escape.
Okay.
He would talk to his friends and he would get the class notes and continue working it. He topped the state.
Oh my God. That is so huge. That is so big. So trust your children.
So he's cured of cancer and he's a state topper.
Wow.
That is what your child can do. Trust them.
Yes. That's also. Thank you for your. I get so much of knowledge from you, and even my audience
Thank you.
will know that. And so, as sir said, don't be like, my child is not going to do that. My child always to be here. My child always has to be in the bed. Don't ever think like that. Survival rates are so high. So get your children cured. Cancer is curable. Yeah, that's all for today. We'll meet in the next section or segment, whatever it is. I am getting actually excited. So thank you.
Thank you very much.
Thank you, sir.